Hi, I'm Dr. Margreet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Pegasus Homeopathics, and more specifically, the maternity range. The Pegasus Homeopathics maternity range is especially formulated for you to take at each stage of your pregnancy and labor. The remedies relieve morning sickness, alleviate back pain, help to ease the labor process, aid in recuperation, promote milk production, and assist with postnatal depression. There is a remedy to help ease mastitis, and the renewal oil will help to prevent tearing and diminish stretch marks. The remedies are designed to help avoid complications and can be very helpful for post-cesarean section and post-birth recovery. The homeopathic remedies are perfectly safe for pregnancy, birth, and breastfeeding. All 8 remedies and the renewal oil are available as individual remedies as well, in 25-gram bottles online on the Pegasus website shop. Visit www.pegasuskits.com. I'm so excited for today's episode where we'll be talking with a friend and a colleague and a partner in a business for maternal health, and that it's Ian Wheeler, the founder of Pegasus. Hi, Ian.
Hey, Margaret, good to see you again.
Good to see you too, and yeah, welcome on the show. We've done some beautiful creation of content before. We've got a beautiful online course on Pegasus Homeopathy, but I think it's really a good time to just have a little chat with you, because for all our new followers, there are still so many people out there that are unaware or not knowledgeable about homeopathy. But before that, we dive into the contents. Just tell us a little bit more about yourself and the work you do.
Okay, all righty. Yeah, I think I'm really blessed because it's a passion. I've had 4 pharmacies over 33 years, retail pharmacies, which I enjoyed. But my passion is natural medicine. So I'm still registered as a pharmacist. I'm the RP, the responsible pharmacist for Pegasus. But I sold the last pharmacy here in Cape Town 2018 to focus on Pegasus. But my consultancy side has exploded. I practice as a homeopathic pharmacist. Okay, so I'm not registered as a homeopath, but I have Dr. Ruth Bloch gave pharmacists and doctors a 3-year course. It was a great privilege. Her life's work, and she was a homeopath for 40 years and a really amazing world-class homeopath. Originally a pharmacist as well, actually, but then she studied in Israel and America. And once I'd done this course, I realized, what an incredible modality it is. And my colleagues, it's not part of our curriculum, needed to know about this. And that's when I designed Pegasus. So that was in about 2003, 2002, launched in 2003. And so when I sold my last pharmacy, I thought I was going to be semi-retired and just working on Pegasus. Well, I'm still doing 8 to 10 hour days, but it's what I love. And it's a privilege and an honor to share this healing with the people, with the world,
Mm.
So, yeah, that's where I'm at.
Amazing. Yeah, you've definitely done a lot of amazing things in your life, and you're not close to stopping, hopefully. Um,
No, no, definitely
You've
not.
got too much passion in what you do. Absolutely, you passion
Correct.
driven,
Yeah.
and that's super powerful. But
Yeah.
Ian, you started off, as you said, you had 4 pharmacies yourself. So you like a typical pharmacist, and then you decided to branch out, solely focusing on homeopathy. How did that
Mhm.
happen for you, and why did you decide to do that?
Okay, so my first pharmacy was retail was in Joburg, and then I sold up, went sailing for 2 years, and that brought me to Cape Town doing our sailing courses here. And Hout Bay was where I was staying, and I said to my then wife, if we come back to this country, we will come to Hout Bay. There were already 3 pharmacies there, but I opened up with a bit of a Joburg attitude, and we cleaned up. We eventually our own the only two pharmacies in Hot Bay, but attached to was a health shop. And then, for example, Doctor, the universe, you put the intention out there, honorable intention, ask for the help, action it, and amazing things happen. So the one morning, I just finished my homeopathic course on the Saturday. On the Monday morning, I perceived this little old lady knocking on the front door early. I thought, what the hell? I'm trying to set up here. She's probably my age now, but 25 years ago, I perceived her as being a little old lady. That was synchro destiny. I mean, Dr. Andy came from Nova Scotia, Canada. She was 40 years a naturopathic doctor. She'd worked in clinical homeopathic hospitals in London, and she was a herbalist of note. So I knew this wasn't by accident. I embraced her, opened rooms in the health shop, and her and I worked together for about 11 years and created some beautiful remedies. She had a big hand in helping me with Pegasus, with her old experience, my modern knowledge, my retail pharmacy experience. I knew what young mothers, families at home need, and then created the Blue Box, and later on the maternity kit, which I think we'll focus on a bit today.
Sure, that's a beautiful journey, and towards destiny also. But Ian, for many people, they don't really. You made a conscious decision to move away from pharmaceuticals and the pharmaceutical industry into more natural focused, natural remedies and homeopathy for that matter. Just for the people out there, why do we need to pay caution to just medicine in general? I mean, especially for women that are pregnant, all of a sudden they become aware of it because now you have a little fetus growing in there. So medicine,
Another miracle, eh?
yeah,
Yeah.
so you become extra careful. But what is the to caution that we need to have with pharmaceuticals that have just become so part of our lives? We just pop pills whenever so easily.
Margaret, life is busy, hey, and the modern world we live in the last 50 years, time has sped up. I think no one will debate that. Hey,
Yeah.
things happen faster. I think the world is in a huge transition, and the speeding up of time is part of that. So people go to allopathic drugs, chemical drugs, a quick fix because they're busy. Take a pill and it fixes it. All that chemical is doing is generally suppressing the symptom. When it makes you feel better, you have a bee sting, you take an antihistamine, it feels better. But it hasn't healed the bee sting per se, it's just suppressed the body's response to the inflammation and the itch. Every chemical drug, every allopathic drug will have a side effect. When we dispense, we are always weighing up the beneficial effect to the side effect profile. And the longer you use the drug, it will generally exacerbate the side effect. And then you need another drug to counter that side effect. So you see chronically medicated patients on 4 or 5 drugs. The 2 originally for, say, blood pressure and cholesterol, but then they add more as the side effect profile, and it just becomes a morass. So homeopathy is very complementary to our allopathic drugs. So in my pharmacy, I would often use homeopathy to wean patients off of chemical drugs where applicable. You would never take an asthmatic's patient's allopathic drugs away, or blood pressure, for example, but where it's applicable, and that's when I consult, my forte is I know the drugs, I can then often introduce a natural protocol, both homeopathic, herbal, and nutraceutical. We always start with naturopathy, eating correctly. You don't put diesel into a petrol engine or vice versa. So we start with a blood type. I use the blood type as a guideline for the food management. Dieting is a dirty word. It's food management. You can eat all day long if you eat the right stuff. So that's where I come from.
Yeah, exactly. No, it's so important that we put it out there. In a world where, as you said, is on high speed and we like to pop pills. I think we've all been so conditioned because we grow up in this world, but it hasn't always been like that. Like I believe that back in the day, it was very normal to work on your symptoms and on herbal medicine and natural remedies.
Exactly.
And it's been sort of pushed out of the mainstream. And now we are in this era where we have so many people actually living under the harm of pharmaceutical drugs.
Exactly. Look,
Yeah,
big pharma is huge,
exactly.
and yeah, but the important thing I must stress is that there's a place for it.
Yes.
In critical situations, it can be life-saving, but the homeopathics do not interfere. So even if a patient's on chronic medication, you can give the homeopathic remedy. And like your pregnant mom, a pregnant woman, she doesn't need to suffer a headache or a cold and flu just because she's pregnant.
Mm.
The homeopathic remedies are all 100% safe and lovely tools for her to use.
Exactly. So now let's just move to the homeopathy medicine. I'm
Yes.
my tongue.
Your tongue.
Homeopathics. Um, yeah. So just explain how homeopathy works and how it is such a good modality for pregnant ladies.
Okay. So the way homeopathy works, everyone knows arnica. I think it's quite a common homeopathic remedy. It's made from the plant. In the homeopathy is made from many starting substances, plant, mineral, animal, um, you name it. Okay, poisons even. So if you take Arnica montana, in this case herbal, Arnica montana, we macerate the plant, steep it in alcohol for a period of time at a certain temperature, and after about 2 weeks, you've drawn out the mother tincture, the mother essence of that herb, the alkaloids, the glycosides. If you, me, and the listeners or the watchers, we call them, had to drink that, you will present with sore, stiff muscles like you've run a marathon. You look as though you've been beaten black and blue. You'll be bruised. You'll bleed from your gums, possibly other internal bleeding. So that starting substance in raw is poisonous to us. However, if I produce a homeopathic arnica from it will cure exactly those symptoms, like cures like.
Mm.
Okay, so I believe we are created in God's image. We have an innate healing ability within us. And all that homeopathy does, like the other energetic modalities, it's the catalyst. It initiates the appropriate healing response in the body.
Mm.
Homeopathy will never do the wrong thing to the body. If you give the wrong remedy, it'll do nothing. It needs a symptom to act upon. So therein is a big advantage for the young mother at home who maybe doesn't have a lot of medical knowledge. She doesn't need to diagnose. All she's got to do is match the correct remedy to the presenting symptoms. So she doesn't need to know why the child's got a fever. Obviously it is useful to have that, but in this case, she doesn't need to know. She just gives the Pegasus teething pain and fever. It helps the body use the fever as a healing tool.
Mm.
So a lot of moms worry about a fever spiking and the child fitting. It's very rare. In the 33 years I've been doing this, I've seen it once or twice, and that's when the fever goes from normal 37 to 39 in like 20 minutes, half an hour.
Wow.
That is dangerous. But if you give the homeopathic remedy, it helps the body remember, the body creates the fever to kill viruses. That's how we build the immune system. So if you give Ponstan or Stopain or whatever antipyretic allopathically, you're actually inhibiting the body's natural response. Rather use the homeopathy. It helps works with the body to do the right thing, and most optimally so.
Yeah, you explained that so well. And it makes so much sense the way you explain it. And the beautiful thing is that it is safe. So if a woman is pregnant, because then we know we can't take any medicine anymore, but homeopathy is safe because it doesn't come with side effects.
From the first trimester, 100% safe. And
Yeah.
the reason for that is we work with high potency. There's some lovely homeopathic ranges on the market. They've paved the way for homeopathy, but a couple of them are a bit paradigm. They're stuck in low potency. And like I said earlier, 100 years ago, or 350 years ago, when Dr. Hahnemann rediscovered homeopathy, life was slow. There were no cell phones, no microwaves, people were on horseback. So the low potencies were fine. But in the modern pace of life, I work with 30C up to 200C, which translates into a rapid response to the symptom. But most importantly, it's always trying to heal the cause, the underlying cause. So as a pharmacist, that's very important because most of our allopathic drugs are just treating the symptom.
That's right. Yeah. So if you are a mother and or a pregnant mother for that matter, how can you use homeopathy? Do you need to go see a homeopath, or how can you advise them to go about it? I mean, you've got amazing products that
Okay.
you've developed. Talk us through them.
All right. So having done my course, and I was intuitively drawn to homeopathy particularly, but I encompass holistically all the modalities. But the
Mhm.
blue box, for example, covers 29 remedies of the most common ailments a young family will encounter: nausea, vomiting, diarrhea, sting, bites. The remedies, the names pretty much tell you what it's for.
Mhm.
The little box with all the remedies in it, they can all be bought individually, okay? And we supply through retailers, Dischem, Wellness Warehouse, most health shops, independent pharmacies. If a patient goes to a pharmacy that doesn't have it, the pharmacist can order it the same day from I distribute through the pharmaceutical wholesalers nationally. But the blue box, it doesn't expire. Homeopathy doesn't expire because it's energetic. Just keep it sealed away from moisture and strong aromatic smells. It's forever. Once you bought that kit, it can be refilled. It's lovely. It's lovely to travel with. That's the size of it. You grab that, a young mother with 2 or 3 children, a lot to think about. Grab your box. It can deal with over 100 conditions.
Wow.
Totally safely because I work with high potency. There's no measurable molecular mass to cause an anaphylaxis, an allergic reaction.
Mm.
So that is why it is safe in pregnancy, while she's breastfeeding, the newborn baby, children under 2. These are all areas where we as pharmacists battle. We very few drugs we can or want to give.
Mm.
And this fits a beautiful niche there.
So every family should have one. I see that on your poster. Every home
That
should
is
have
my
one.
logo.
Yes.
I share with you my own boys. I had my pharmacies 33 years, 4 of them. They are 32 and 35. Can't believe that, but it's true. This is how time goes.
Yeah.
They've each ever had one antibiotic in their lives. And on
Wow.
both occasions, they were away from me. They were with me. The one got tick bite fever. The other one was having that silly pet rage party, got a severe throat infection. If they were with me, they wouldn't have succumbed, more than likely.
Wow.
So
Yeah.
surely that endorses homeopathy, hey?
Yeah, the proof is in the pudding for sure. Amazing. Yes,
Exactly.
sure.
Yeah.
Okay, so that is the blue box. It covers like all your ailments that everyone can occur to anyone, and it doesn't expire. I think that's quite incredible. And they are small sizes for travel, easy for travel,
Yeah.
and you can buy
That
refills at any time.
That
Yeah.
little 10-gram vials in the box, which is 50 doses, that's enough for 2 or 3 episodes. When that runs out, they go to the pharmacy, the health shop, they buy the bigger one. That's what
Mm.
they look like. It's at 25 grams, 150 doses. They retail at about 180 Rand. So it's not much more than R1 a dose. And the fact that it doesn't expire makes it cost effective. But back
Amazing.
to your first question, how easy is it for mothers to use it? It is. If there's a deeper chronic issue,
Mm-hmm.
then they should see a classical homeopath. What
Uh-huh.
I do is called clinical homeopathy. We complex the remedies so that if you, I, and any of the listeners say have a sinus episode and they take the Pegasus sinus, 97% of us will have a very positive response.
Mm.
Each patient individually takes out the remedy. There are about 9 remedies in there. Um, each individual patient will take out the remedy meaningful and pertinent to them. So it still works in a classical sense. Classical homeopathy is where the homeopath tries to find the one single remedy that is your persona, your
Mm.
emotional, physical, mental. But that is very knowledge-based. It takes time. So we
Mm.
don't have that time in retail. So
Mm.
this is the acute short-term approach to homeopathy. But once you catch it early, it doesn't generally the condition doesn't evolve into something more serious.
Right, which is with anything like you self-remedy for so many things, and then when it's serious or complicated, you go see a doctor. So in this case, you see a homeopath. Yeah, and
Yeah, homeopath. Yeah,
that makes sense. So
yeah,
you've actually just made it very user-friendly and easy accessible for everyday
exactly.
use. Beautiful.
For both my colleagues and for the young mother at home, who's our
Yeah,
major focus.
yeah, beautiful.
The other advantages of homeopathy is that you can't overdose. So we medicate onto little sugar pillules, not lactose, but sugar pillules.
Mhm.
So often, twice, three times a week, I get a mom phoning me frantic. The child got hold of the bottle, consumed all of it, if not most of it. And happily, I can say, look, all that's happened, one expensive message has been sent to that. Because every time you dose homeopathy, it's not a drug, it's a message of healing to the body. So the child will have a sugar overload, they'll go ballistic for 20 minutes, but no harm is done.
Mm.
So a dose, whether it's a newborn infant, you and I, or a horse, is 4, not more than 5 little pillules. So if they've eaten the whole lot, you've just used a lot of pillules to send that one message.
Amazing.
So it's very safe. Okay.
Yeah, that's very
And,
reassuring.
and homeopathy will only do to the body that which is supposed to happen. So the body knows what it's supposed to do. Homeopathy just makes that healing process as optimal as possible.
So support the body systems in functioning to optimally.
Exactly.
Yeah.
Exactly.
So you also have the maternity and labor kit, and obviously the body is then working with a lot of messages too. And how does homeopathy works in that space when it
Okay,
comes
so
to birth?
yeah, so you just give the appropriate remedies to those conditions, you know.
Mm.
So that's what our little maternity kit looks like. It's got 8 remedies and a renewal oil. The renewal oil is a high quality tissue oil with specific herbs, very good for circulation, inflammation. So the mother to be will apply that to the perineum before and after the birth, so that there's no tearing or limit the tearing. It's good for stretch marks. Dr. Anderson used to use that on her face, and she had skin like porcelain. Quite amazing. So it's
Wow.
good for scarring, stretch marks, etc. So pretty much in there, it works from the first early pregnancy, the morning sickness, a remedy called VMT, vertigo morning travel sickness. It's in the blue box as well, but
Mhm.
that's the first remedy. The second remedy is the pregnancy remedy. You know, we are right behind you in promoting natural birth, and it's
Yeah.
becoming more and more of a challenge. Hey, I
Yeah.
mean, the gynaes and obstetricians are promoting C-section big time, and maybe easy for a man to say, but women are designed to give birth. Am I
Totally.
right? I mean, yeah.
Absolutely.
So the idea of using the homeopathy, it's going to help the mom prepare her body, which it's doing. It's optimizing the preparation for birth.
Yeah.
Then that's taken from the 30th week. Then in the last 2 weeks, from the 38th week, is the birthing remedy. So that's for natural induction. Okay. So it's going to help the body give birth. All right. Once the mom's had her baby, there's a postnatal remedy. So that is to recover. Should there be a complication and the mom ends up having a C-section, the same remedies are pertinent. There's hypericum, the arnica of the nerves. There's arnica for bruising and swelling. Um, there's remedies for stinging and burning, tearing. It covers the healing is half the time. It's quite amazing. Okay. And then there's a postnatal blues remedy. Should there be an emotional aspect for the mom? Rather, we don't want to turn antidepressants. So that's the homeopathic antidepressant, really. There's a lactation remedy if the mom needs to help the milk along, the quality of the milk. There's a mastitis remedy should she get breast inflammation, cracked nipples, all
Mm.
those related things. It's there. And there's a hematonic, brilliant for anemia. If the mother's had a heavy birth, lost fluids, lost blood, it will get her up to speed very nicely. All my women that are anemic use that remedy. What it does, it doesn't just put natural iron back into the body, it helps the patient assimilate iron from the food they eat. So it really, I mean, I've had a woman, she was an older woman, on intravenous iron, and
Mm.
the hematocrit hardly moved.
Yes.
Gave her the remedy in conjunction, and it absolutely accelerated. So
Mm.
yeah, that's what homeopathy does. Eh?
Yeah, that's so amazing. So that is a beautiful kit for every woman actually to have because it helps her right through from early pregnancy till postpartum, lactation, everything. Sounds amazing. Um,
Yeah.
and where can they find these kits, Ian?
Okay, so yeah, again, all the retailers, they don't always keep a kit. Discount is pretty good. Wellness Warehouse is pretty good. But some of the independents, the kit sells, the retail is 1,290 Rand, which
Mhm.
sounds a lot. They are nappy coded, so people on medical aid can claim through their medical aid. Different medical aids pay different amounts, okay? So your blue box is, but if you divide the 29 remedies by 1,290, it's like 45 Rand a remedy
Mm,
that doesn't expire. These, when they retail independently, they're 80 Rand.
mm.
So the box is actually cheap, you know.
Yeah.
Um, so it's almost your postnatal box. Your maternity box is your antenatal box.
Mm,
They also make lovely gifts
mm.
for stalk parties, or what do
Sure.
they call them nowadays? Not stalk parties,
Our baby shower.
gender. Oh, yeah. Yeah.
Yes.
So yeah, that's the story.
Amazing.
So if they go to a pharmacy or wherever and they don't have one in stock, they can order from the wholesaler and have it the same day, if not the next day.
Right. Um, you can ask the pharmacy to do that. Yes.
Yes.
Right.
Yeah.
Yeah, and you can also order online from your website.
Thank you. Absolutely. Yeah. I know we do a lot of online sales, and I think it's at a special price on the online. I don't know exactly what that is, but it
Yeah.
could be like 1,000 or 1,100. I know it's a special price, including the courier.
Yes. And the maternity kits, we are talking the same kind of money.
E- Exactly. They normally retail at about 590 or 690, but I think they 500 through on the online store. You can also, if people go to the website, to the shop, you'll see there's a combo as well. If you buy the combo, I think it's like 1,390 for both, or something like that. But it is a very good special.
That's
Yeah.
amazing. And it's such a worthwhile investment. Um,
Yeah.
and the maternity kit also doesn't expire. So if you have
Exactly. It
few
could be used for the fourth and fifth baby.
yes.
No, not exactly.
Uh, no, as a midwife, I had a maternity kit at hand always.
Yes,
So I think for every midwife, it's lovely to have that in their toolbox, toolkit for
yes,
use,
yes,
even if a mom doesn't have it herself. So during labor
yes.
or for induction of labor, women that's just niggling, wanting to go into labor, but it's just not happening, or reaching that post-date awkward time. So they're very, very useful for midwives working in the birthing space, obviously.
So,
Um,
so Maria, thank you brought that up. For the midwives, only Wellness Warehouse stocks the maternity individual remedies.
mhm,
So again, if the little 10 gram runs out, they can go and buy the bigger one, top up the little bottle, keep their kit intact.
mm.
But otherwise, the maternity should be bought online from us.
Right.
So
Yes.
for your midwives, the midwives can buy directly from us if they want to stock in their practices.
Right. That's great that we quickly talk about it. So that's the individual remedy. So if you want to, if there's one remedy you keep using all the time, that can say you just
Yes,
can just buy a single remedy. You don't have to get a whole box.
correct.
Yeah.
It would be in the 25 gram. It looks like that,
Yeah.
150 doses.
Brilliant. Yes, that's super helpful for our birth workers. Wonderful. So,
Yes,
we will set write your website and all your details in the show notes of this episode.
thank you.
Otherwise, for the listeners, you can just Google Pegasus Homeopathics. Yeah, I don't know. I've struggled with that word today. And you will find it. You will find it. And as I know Ian, he's always very willing to answer your questions if you have specific questions for birth workers.
Last thing,
Yeah.
Margaret, I need to call you Mariette now. Each kit has a little booklet. So there's the maternity booklet, there's the blue box booklet. We even do a pet range. Animals respond incredibly well to homeopathy. So when
Amazing.
I teach the final year pharmacy students and I explain how it works, the whole dilution, succussion, well, it's actually potentization, but they see it as dilution. They'll say purely placebo. I say every modality has some placebo. If you go to your doctor, you're not going there to get unwell, you're going there to get well. So there's a placebo effect. But explain to me why a newborn infant, a dog, a horse, a cat, within 3 doses, the whole symptom picture changes dramatically.
Right.
So, that gets them thinking. But there's a lot of information in those booklets. It's on the website. And so if you want to see what remedies are in each remedy and what they do in context to the condition, it's all there.
Wonderful. Yeah, and also how to take it, etc. Yes.
Exactly.
Wonderful. Ian, I just want to personally thank you for making homeopathy so accessible and for these remedies that it's easy for us to get our hands on it, and always being so willing to educate us about this modality. It's knowledge that empowers us, right? So thank you so much. Yeah.
Exactly. No, well, thanks for having me. I mean, it's my passion. I love to share this modality. So yeah, all good.
Awesome. Thanks, Ian.
Don't get some waves.
I will. Thank you. Yeah, we share both the passion of surfing. Hey, that's another passion.
Have one for me, but keep it under 8 foot. All right.
Okay.
Thank you.
We'll try. Okay.
Oh, great, Margaret.
Thanks, Ian. Thanks so much.
All the best.
All the best. Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.